But what about health? When we think about storytelling, it can be a way to promote health behavior, especially in communities with a strong link to storytelling, like we just talked about. And if there's a history of medical distrust, and we have that history in communities of color, it can allow us to connect, it can allow us to overcome barriers. It's a way that, through storytelling, it's a way to process new information, regardless of the person's literacy level, expertise, or culture. So it can bridge that gap and maybe help reduce health disparities so we can achieve health equity. So what's happening with storytelling? Well, what the research shows, there are 3 ways that this can impact health behavior. Through transportation, which is when the listener gets swept away or immersed in a story, and that makes the listener more likely to agree with the story's message. And then there's identification. If the listener can identify with the storyteller or the characters in the story, the listener is more likely to adopt the message in the story. And then social proliferation. That's the idea of the discussion of stories and then reinforcing the messages and allows for that social support of a story. So those are some ways that storytelling can impact health behavior.